as part of the Africa 2020 season. Univers Science, comprised of its two venues, the Discovery Palace and the City of Science and Industry, is the house of science, technology, innovation, and therefore it is the house of those who work to progress science and innovation. Before the crisis, I said that science was everywhere. It started in your pockets with your smartphones. And then what can we say today? A year after the onset of the health crisis, we have seen science that has developed, that is at the center stage of our lives, our democratic debate. We have seen huge experiences and experiments, and that is science that is happening all around us. So when Ngoni Fall, the General Commissioner of the Africa 2020 season, suggested that we organize an event dedicated to research and to the fight against COVID-19 in Africa, we did not hesitate a single second. The originality of this season is that we are able to invite people from Africa, and this is what the forum is about today. This forum has been organized with the Institute for Research and Development with Univers Science, which has just signed an agreement. And I would like to congratulate Valérie Verdier for her participation. We will be giving the floor to players right across the African continent, to young entrepreneurs, doctors, researchers, and this will enable us to see what responses have been rolled out in Africa to fight the COVID pandemic. I'm very impatient to hear about it all today. I would like to thank everyone, and I would like to thank all of those who have taken part in organizing this forum, in particular the embassies of France in Africa, in South Africa and Ethiopia. Thank you very much to Julie Lancriette-Gorrig and Samir Abdelkrim for their advice and support. Thank you to the teams at Univers Science, to Ngoni Fall, and to all those who have contributed to organizing this online event. I would now like to give the floor to Madam Fall, who is the General Commissioner of the Africa 2020 season. Have a good afternoon. Good afternoon, everyone. Thank you very much, Bruno. Good afternoon, everyone. I'm very pleased to be here with you today. Just a few words to remind you about this exceptional season, the Africa 2020 season, which involves the entire African continent and which is being rolled out in France and in overseas territories since November and until the end of September this year. This season emphasizes innovation in arts, science, and entrepreneurship. I designed this season to be a platform of sharing and questioning, and we have a number of topics: the dissemination of knowledge, technological innovation, and the economic emancipation of citizens. From the very outset, we wanted to ensure that we had a moment to take a look at these issues together. So this month of debate should have taken place in September 2020, given its name, the September Summit. We kept the title of the summit, and the summit will take place in March. It began on the 26th of February at the Quai Branly Museum with a remarkable inaugural event with the Professor Achim Bebe. We had 30 or so forums and conversations, and we're coming to the end of that period. The two final forums are taking place at the moment in collaboration with UNESCO. To begin with, we did not have a forum dedicated to COVID because COVID caught up with us. But it seemed to me to be important, given the context and given the lack of information that we've had from the continent, the African continent, to know exactly what happened there. There were a lot of alarmist evaluations with the death toll, but it is not the case. That does not mean that there have not been a number of deaths. I think these statistics that we have for the different countries don't necessarily reflect reality. But in any case, what I do know is that scientists, researchers, and people who work in tech mobilized themselves immediately, worked in networks to find solutions for screening, for tracing and also to try to obtain vaccines. And we are part of the international mobilization that we are seeing at the moment. Therefore, I think it is natural and legitimate to work with Universcience, which is a partner of this season. And I wanted to see whether they would accept organizing a forum on this topic. And I'm very happy that they accepted to take up this challenge. I would like to thank the entire team. I would also like to thank the team at Emerging Valley. I was able to follow all of the discussions. Emerging Valley will be organizing their own event on the 7th of April. I would also like to thank all of the teams from the French Institute, which is one of the organizers of this season and also a financial partner. And for this forum, we also have the support from the Agence Française de Développement. I unfortunately will not be able to stay because I have a very busy day today, but I may pop in from time to time to hear what has been said. I would like to wish you a fruitful afternoon, and I'm sure that you will be a source of inspiration for us all. Thanks to you, I am sure we will have a more comprehensive snapshot of COVID research on the African continent. Thank you very much.
Mrs. Ngone Fall, Chief Commissioner of the Africa 2020 season, Mr. President of Universcience, Mr. Bruno Maca, ladies and gentlemen, dear colleagues, the IRD days are currently taking place in Marseille. That is why I am unable to attend the opening of this important forum, the Africa 2020 Research and Innovation Forum. I deeply regret it, all the more so that this forum that we are a partner of is dedicated to the response of African nations to the pandemic of COVID-19. As you all know, IRD has supported the fight against COVID, in particular with our partners in Africa and elsewhere in the world. Our teams have been involved daily in Senegal, Burkina Faso, Cote d'Ivoire, Benin, Cameroon, DRC, Guinea, and Madagascar, involved in more than 60 projects about COVID-19 in the framework of research that was co-built with our partners through our research unit and the mechanisms that we have built together in partnership. The links between health and environment are at the heart of these research programs. That is the case for the important international initiative PREZODE that was announced at the One Planet Summit. Its goal is to prevent the emergence of zoonosis in a One Health perspective. A dozen structures and partners in sub-Saharan Africa, as well as the Institut Pasteur in Guinea and Senegal, have shown interest in co-building this international initiative and this French initiative. The Research and Innovation Africa 2020 Forum is an opportunity to listen to the people mobilized on the African continent to fight against the pandemic. We are living through a crisis, and it is essential to share with a bigger audience the questions, progress, and innovations that came from research in the field of health and in other fields as well. I think that we can all agree on the fact that science needs to echo the main environmental, health, economic, social challenges that we are all facing today, and that it needs to take into account the cultural context of the countries involved. Moreover, IRD thinks it is absolutely necessary to support open research processes with society and to support the ownership of scientific knowledge by citizens, in particular youth. It is in this perspective that IRD has developed for a few years now fruitful cooperation with Universcience. And I am pleased that we have recently signed a framework agreement between us because we will be able to reinforce our common mission, that is to say, share knowledge and disseminate scientific culture. We have put into place a rich program of actions with Universcience. I'm thinking about the series of conferences, My Planet Tomorrow. It is organized in the framework of other important international events in 2021. These conferences will be an opportunity for researchers and development actors to meet and exchange about main world challenges like water resources, biodiversity, climate change. We will be able to listen to many different voices of the South. The first conference, organized simultaneously in Senegal, will study the issue of preserving and sharing water resources. The Africa 2020 season is also an opportunity for Universcience and RRD to work together. This forum is an example of our partnership, but there will also be the Botanica Festival. The workshops organized in that framework will be an opportunity to discover the extraordinary diversity of wild and cultivated plants. There will also be movies made in Africa and co-produced by Cité des Sciences. That is why I'm so happy that IRD is a partner and an actor of the Africa 2020 season. This initiative is a celebration of the immense innovation and creativity of African youth. Africa 2020 is a wonderful opportunity to mobilize a bigger audience and arouse the curiosity of scientific minds. Africa 2020 echoes the IRD's commitment towards open and shared science that listens to the needs and expectations of citizens, and a science that opens a dialogue with people. And for now, I wish you all a great forum.
Eh bien, merci. Bonjour à tous.
Wonderful.
Merci beaucoup.
Hello to you all.
Merci, Monsieur le Président de
Thanks to
Universcience,
the President of
Madame
Universcience.
Madame la
Thanks
Présidente
to Madame
Verdier.
Fall.
Merci,
Thanks
merci
to
à tous
Madame
pour
Verdier.
cette invitation déjà.
Thank you all
Et puis
for
merci aux
inviting
startups
me.
aussi,
And
qui
thanks
sont
to
là
the
présentes
startups who are
commence
with us
ce
today.
débat sur quelle a été
We are now
la
opening
riposte
a
de
debate
l'Afrique
on the
africaine face à la
response of
Covid-19. Je
African
tenais vraiment
nations
à souligner à
to
quel point
COVID-19.
ce débat
I wanted to
arrive à
underline
point nommé,
that
mais
this
surtout
conversation
la place importante
comes at a right
et légitime
time.
dans le cadre de cette saison Africa 2020. Et je voulais
It takes
à
place
nouveau
in the Africa
remercier Ngone
2020
Fall pour
season, and I really
les
want to
efforts
deeply
incroyables qu'elle
thank
déploie pour
Ngone Fall
mettre en place
for
cette
what she
saison
has
avec
done
tous ses
to
partenaires, avec l'Institut français,
create this
avec
Africa
l'IRD,
2020
avec
season with
Universcience, avec
IRD,
l'AFD et
with
beaucoup
les
d'autres.
instituts
Et
français,
nous sommes très heureux
with
à Emerging
Universcience,
Valley
and we
de
are very
participer à ce
happy at
rendez-vous
Emerging Valley
science
to
de
be
la saison
involved
Africa
in this
2020.
project.
Et je vous donne rendez-vous moi-même
And
le 7 et 8 avril
personally, I
pour
invite you
Emerging
to
Valley,
join
où on
us on
traitera aussi de
the
ces sujets de
April the
e-santé. Et
7th and
d'ailleurs,
8th on
Ngone y
Emerging
sera,
Valley.
ainsi
We
que
will
Madame Verdier de l'IRD et beaucoup des startups
meet
qui
again
seront
with
d'ailleurs
Madame
sur ce panel.
Verdier and
La
other
question qu'on va traiter
entrepreneurs and
aujourd'hui, c'est
companies that are
véritablement
present
quelle
with
a
us
été,
today.
depuis
The
le terrain,
issue we will talk about today is what
réponse
happened on the ground.
numérique, la
What
réponse
was the digital
entrepreneuriale
response, the response from
à la Covid-19, à la pandémie.
entrepreneurs
On
and
voit aujourd'hui,
companies
et je
to
reviens
the
d'un long
COVID-19
déplacement
pandemic.
en Afrique de l'Ouest, à quel point les sociétés civiles se sont
In West
mobilisées
Africa,
dès
citizens really
des premiers confinements,
mobilized at
dès
the
mars
onset
2020.
of the
On fête le
pandemic
premier
in March
anniversaire quelque part,
2020.
triste à
Right
dire,
now, we are unfortunately
de
celebrating the
l'arrivée de la
first
Covid à l'échelle
anniversary
planétaire,
of
de son expansion, de sa transformation en
COVID
pandémie.
and
On a
the
vu comment
transformation
les
into a
entrepreneurs se sont
pandemic,
mobilisés
and we
à travers
saw
notamment
how
les écosystèmes, à
entrepreneurs
travers l'intelligence collective.
mobilized,
On a
how
ici
they
sur ce
used
panel
ecosystems,
des
collective
startups qui
intelligence,
se sont
startups
particulièrement illustrées
to
à travers des
really
hackathons,
fight
notamment en
together.
Tunisie. On
There
a
were
vu
hackathons
des startups
organized
qui ont
in
développé des
Tunisia, for
solutions,
example,
notamment
and a
au
lot of
Sénégal, qui ont
companies
permis de
found
toucher la base
solutions
de la pyramide, les
to
populations les plus
help
fragiles à
people
travers les
underground, to
technologies
help the most
SMS et
vulnerable.
USSD. On a vu
And
aussi
we saw, for example,
des
solutions
startups,
using
et elles sont sur ce panel,
USSD.
et je vais vous les
And there
présenter,
are
qui
people
ont
with us
travaillé
today
le partage de
who
savoir, l'intelligence
really
collective, de
shared their knowledge,
mutualiser à
used
travers
collective
tous les réseaux
intelligence,
de
used all
médecins
their
francophones,
networks,
comment
the
mieux lutter
networks of
contre la Covid
French
en partageant
doctors, for for example, and they really
l'expérience
used the
acquise
strength
sur une
of the
maladie nouvelle que personne ne
communities
connaissait.
to
Et nous
work
allons avoir le
on
témoignage
this
d'une des
disease
startups
that
qui a
was
mis ça en
something
place
new.
en Afrique.
And
Et ces
there
startups,
was a lot done
eh
in
bien, nous en
Africa.
avons
These
plusieurs d'Afrique francophone, bien
startups
entendu,
are here with
aussi
us today
d'Afrique anglophone. Nous
from
avons la chance d'avoir
French-speaking African
une
countries
très belle
and
startup
English-speaking
qui vient du
African
Nigeria,
countries.
des
There's a
startups aussi
company
qui
here with
viennent
us
d'Afrique
from
du Nord, et on
Nigeria,
voit que l'ensemble du continent est
and
représenté dans ce
the
panel.
whole
Et je
continent
vais
is
d'abord commencer
represented
par
today.
me présenter
I
et
would like
ensuite
to
elles prendront la
introduce
parole.
people
Malik Diouf, qui est le
first,
fondateur de
and
l'Africa Mobile, qui
first I
vient du
would like
Sénégal.
to
Est-ce que
introduce
Malik, tu nous entends?
Malik Diouf. Are you here with us, Malik from Africa Mobile? Yes,
Enchanté,
I
Malik.
can
Tu vas nous
hear
présenter un
you
petit
well.
peu comment
So
ta
Malik,
solution
you will tell
d'adressage de
us
contenu, tu as réussi
how
à la
your content
transformer en outil
addressing
massif de sensibilisation et
to
d'information pour les populations, pour les
enabled
former et
your
pour les
company to
inciter à
share
adopter les gestes
information
barrières
to
jusqu'au
really raise
village le plus
awareness
reculé du
about
Sénégal. Nous
COVID-19.
avons aussi ici Adama Traoré, le
With
fondateur
us
de
today as
Diagnose Me.
well,
Est-ce que
Adama
si Adama, tu nous
Traoré.
entends?
Are you with us, Adama Traoré from Diagnose Me? Yes,
Voilà,
I can
tu es
hear you
aussi avec
fine.
Émilie Fatimatama
Emily
Saba, qui est
Fatimatama
développeuse
Saba
web,
is with
et
you
tu es
as well.
aussi
She's a
avec
web
Eric Maville,
developer,
qui est un peu
and
le grand
Eric
témoin, qui est le
Maville
directeur général de
is
Santé en
the
entreprise.
General Director of
Et on
Santé
va
en
vous
entreprise.
entendre tout à l'heure. Ce qui est assez
You will all
puissant
talk
avec ton
about
projet,
what
c'est
you
que
did
ton
a
application
little
de diagnostic a été
later on.
conçue dès janvier 2019,
You actually
2020, pardon, janvier
created
2020,
Diagnose
au
Me in January
démarrage de
2020,
l'épidémie,
right at the
et tu as
onset of
été
the
notamment
pandemic.
identifié et
You
récompensé lors d'un tout premier hackathon
actually
pour lutter contre la
won
Covid, qui s'appelait le Hack for
at the
Wuhan, qui a été
Hack
développé
for
par la Chine
Wuhan
d'ailleurs, et tu vas nous en
hackathon,
parler.
a Chinese hackathon. Maybe you can talk about this later.
I hope the translation is already operational. Nous avons aussi la chance d'avoir la startup nigériane Pricepally, avec Luther
Pricepally is with us
et
today with Luther and
Mosunmola
Mosunmola Lawin. You are co-founders of Pricepally. Can you say a few words?
Hi.
Okay, perfect.
Good to be here.
Welcome. Nice to meet you.
Thank you very much. Same here.
So Pricepally est une, alors je continue en français, est une coopérative agricole qui permet de réduire les intermédiaires et de mieux rémunérer les agriculteurs
is a company that enables farmers to get more money and people to get fresher produce to their home. And you created this during COVID to help local populations and also rural population during the pandemic. You also had to face lockdowns,
à quel point les populations qui vivaient dans les zones rurales étaient fortement pénalisées.
It was a hard situation for people living in rural areas because they were unable to go to cities and sell their products. And there was also a curfew in place. And we have with us today another startup,
qui est la plateforme d'échange
with
entre médecins
Cédric
africains, qui a permis à plus de
It's a
5000 médecins
network
africains
for
à travers
African
la
doctors.
République démocratique du Congo, à travers la Guinée, à travers le
And
Sénégal,
this
de
platform is
mutualiser leur
used
expérience.
in
Cédric, est-ce
Niger,
que tu nous entends?
DRC, Guinea. Cédric, can you hear us? Yes, I can hear you.
Eh ben, bienvenue Cédric, on a hâte
Welcome,
d'entendre ton
Cédric.
témoignage. On va
We
donner la
are
parole
really looking
après. Nous
forward
avons aussi la
to
chance d'avoir
hear
Caroline
from you.
Fatou Ndiaye,
And
qui est la fondatrice de
Caroline
Senvital,
Fatou Ndiaye is
qui a développé
also
un
with us
passeport
today from
universel de
Senvital.
santé qui
They
permet
have
d'accéder aux
developed
informations
a
médicales
health
des patients
universal
de manière
passport,
instantanée, sécurisée, sous la forme en
secure
fait, d'une
system
carte,
to
d'un
share
bracelet
health information
qui est disponible aussi
using
dans
a
les langues
card or a
vernaculaires.
bracelet or a sticker.
Caroline, est-ce que tu nous entends?
Caroline, are you here with us? Can you hear us?
Alors peut-être que ton micro n'est pas activé, Caroline.
Maybe your mic is not on. Caroline isn't here yet, unfortunately.
Bienvenue Caroline. Et enfin, le dernier témoignage vient de Tunisie avec Smartbox et le fondateur de cette très belle start-up ainsi que son témoin qui va aussi parler pour mettre en perspective cette innovation. Donc Mahmoud Belbehir, qui est le fondateur de Smartbox, et Raouya Kria, qui est architecte spécialisé. Donc Smartbox, c'est une vraie innovation qui permet de recycler les conteneurs maritimes pour construire des logements, des bureaux, des écoles. Et dans le cadre de la Covid, cette société a remporté un grand hackathon en Tunisie, le HealthTech Covid Challenge, en transformant ces fameux conteneurs maritimes en hôpitaux modulaires pour traiter, isoler les patients Covid-19.
modular health centers during the crisis. It was really useful in Tunisia, and the Smartbox company actually won the Health Tech COVID Challenge. That was organized by a collective of startups in Tunisia. So maybe you will tell us a little bit more about your project, how it helped with the resilience. Resilience is a word that we will use a lot during this conversation. Now I would like to give the floor to Si Adama Traoré. Can you first introduce your project, your company? I think there's a video that you want to show us. Maybe you can tell us a little bit more about your innovation. You can tell us about what happened in January 2020 in China with the hackathon. And there will be Emily as well, who will tell us a little bit more. And Eric, again, is the General Director of Santé en Entreprise. And they organize health caravans in Africa.
Oui.
Thank you very much. There has been a last-minute change, and so Mr. Maville will not be present here today.
D'accord. Ah bah, tu as plus de temps alors.
Okay, well, that means that you have more time then.
Tu as plus de temps pour
Thank you very much.
ton innovation.
So you have more time to talk to us about your innovation. Thank you.
Alors, je crois que tu as une présentation.
Oui. So my name is Si Adama Traoré, and I have a video to begin.
Ouais, très bien.
And this will give you an idea of what we do. Faso Civic is an association of young developers who decided to use their skills to serve the community and the well-being of citizens. In addition to training youth to find solutions adapted to the country's context, we work in research and the development of inclusive projects and the promotion of responsible citizenry. This is why we took part in a number of competitions to meet the crucial needs in the field of education, agriculture, security, health, and many others. Thanks to our determination to serve our communities, we have won a number of innovation competitions, and we are working to implement the projects that won. As it relates to health, we have developed Diagnose Me, which was developed as part of our participation in Hack for Wuhan, which sought to stimulate innovations during the COVID crisis. A number of sub-Saharan African countries are experiencing epidemics that are caused by their tropical climate and the fragility of their health systems, which at the same time must confront the current COVID-19 pandemic. Many efforts were made to try to preserve the efforts that have been made. Early testing and the quick management of the sick is the best way to fight against the infection. Diagnose Me is a digital solution that was designed by engineers in collaboration with health specialists. It makes it possible to identify, to localize, and to manage suspected cases, monitoring and quick management, remote consultation, prevention, and awareness raising. Diagnose Me seeks to reduce the saturation of health centers, which can increase the risk of contamination in the case of a pandemic. It also favors the rational use of screening kits for healthcare workers, making it possible to identify suspected cases. Diagnose Me also is available in local languages, is adapted to young people and to people living with disabilities. It provides a daily service of reporting about the epidemic. Since 15th of May 2020, Diagnose Me has been working to fight against COVID-19 in Burkina Faso and has been downloaded more than 500,000 times. Diagnose Me has a real-time feature, and this enables us to identify suspected cases. It can be adapted to other diseases. There are many epidemics that happen, and Diagnose Me allows us to fight against these epidemics. Thank you. So this video shows what we do at our startup. So if you will allow me, I'm going to now move on to the presentation, which will further explain the Diagnose Me solution.
Plaisir.
Yes, go ahead.
Je crois que la technique va te la passer. Voilà.
So what is Diagnose Me? It is an integrated digital solution for the identification, the localization, and the management of suspected cases. So we had the first case in December 2019. And according to the latest figures, in March 2021, we had more than 117 million cases with over 2 million deaths. When faced with this pandemic, there were a number of challenges that we had to overcome to stop the spread of the pandemic, to avoid the creation of new clusters, to manage quickly suspected cases, to use screening kits in a rational way, and also to raise awareness in real time about prevention. So we have been trying to implement Diagnose Me for a while. It began in January 2020 at the onset of the pandemic. Hack for Wuhan wanted to find digital solutions to respond to the crisis. In this framework, we were able to take a look at our network of startups, and we have members, and we saw that there was a member that we could work and build a team with, a team of engineers. We also had the participation of a doctor. We decided to take part in the hackathon. There were 300 participants from 33 countries, just 2 African teams, Burkina Faso and Kenya. And our solution was among the top 12 finalists. Our adventure did not stop there. We saw the first cases in Burkina Faso, and then we went to see the authorities who decided to support us. The Health Ministry implemented a project with the UNDP, and they launched what we call the Innov Challenge COVID-19. The platform was launched, and this governmental platform made it possible to have a directory of all of the COVID-19 responses. And from the 20th of May, this platform could be downloaded in Burkina Faso. In November 2020, we won the Health Impact Awards 2020 for the implementation of this solution. And recently, we were chosen as among the 4th finalists of the Africa Challenge app. And so the solution, Diagnose Me, as we saw in the video, is a solution that makes it possible to monitor the crisis in real time by identifying and managing cases, by also ensuring prevention and awareness raising. Diagnose Me is comprised of 2 versions, a mobile app and also a web interface aimed at health professionals. The solution is a solution that has been designed so that it is inclusive, it is multilingual. It's available in local languages, in 3 local languages in Burkina Faso. It is aimed at children and adults, and there are also accessibility features which make it possible for a wider number of people to use the system. So how does it work? The experience in Wuhan demonstrated that the majority of people infected in Wuhan were people who panicked and who went to health centers. And what this meant is that there were more contaminations. And so our solution allows us to detect symptoms in real time. And so how does it work? The mobile app for the wider population assesses symptoms and one's level of risk. It also makes it possible to have a remote consultation. And you can also receive information on prevention and other e-services such as web radio, web TV, and also the possibility to follow e-learning modules. For the rapid testing aspect, we have identification, and it identifies any signs or symptoms of COVID-19 in addition to any other symptoms. It also makes it possible to measure the respiratory rate. And all of this makes it possible to apply an algorithm to ascertain whether the person presents symptoms or not, and what type of case it is, a suspected case, a probable case, or a contact case. Among the other features, we have private messaging. We can also follow the evolution of the disease in real time. The app has transcriptions in all languages, and this enables people to better understand, in particular children. There are also systems to prevent fake news about the disease, and then information about the closest health clinics and centers. For the interface aimed at health professionals, there is the possibility to have a real-time monitoring of the pandemic. There is a dashboard. There is a possibility also to monitor suspected cases and to have instant mapping of the progression of the epidemic. And this is a screenshot of the interface. And here we can see whether there are real suspected cases. And management of cases can be done as well through sampling. This makes it possible to assess the symptoms of patients. And so this is a real-time evolution of the pandemic. Since we have finished, DiagnoseMe has been trying to find partnerships throughout Africa in order to enable other countries to be able to benefit from this solution. I will be able to talk about our partnerships later on. We have a partnership with an NGO based in Paris, and we have an agreement to be able to roll the solution out at a larger scale. DiagnoseMe has found a way to be part of the health caravans, and we have launched a project in Burkina Faso. We launched that at the beginning of the year between the 18th and the 23rd of January, and we had a number of people who received information via DiagnoseMe. And for the partners, we have a number of NGOs who are supporting us, in particular the government of Burkina Faso, the UNDP, YOP, and also Perso Civic, who is the commissioner of the project. Thank you very much.
Merci beaucoup, Adama.
Thank you very much, Adama.
Donc, tu me confirmes bien que Eric Maville ne pourra pas être là.
You have just confirmed that Mr. Maville is not here or cannot be here. Would Emily perhaps like to say a few words?
Si elle est là, si elle est connectée.
If she is here.
Si elle souhaite témoigner. Sinon, je vais passer directement aux questions-réponses.
If not, perhaps we can move on to the questions and answers, and then Emily may be able to
la diversité des équipes,
join the conversation to demonstrate the diversity of the teams, and also show the role of women in startups. There are a number of startups, and this is one of the salient things that we see when we look at the African continent. In a recent report, we see that there is an increasing amount of funds that have been raised by female-led startups in French-speaking Africa in particular, but also in Eastern Africa, so Kenya. And I think it's very important to underscore the role of female entrepreneurship, which is absolutely crucial on the continent. I'm going to ask a number of questions, and then we're going to try to see if we can have answers from you both. The first question, you were among the first entrepreneurs of the continent to take part in the COVID hackathon. You even received the Wuhan hackathon diploma. That wasn't spoken about much in France, and the idea was to develop solutions to combat COVID. The first question is, what was the motivation behind this initiative? Well, I will begin by answering, and then I will give the floor to Emily. So the Hack for Wuhan took place on the 6th, 7th, and 8th of March 2020. So what was the motivation behind this? As I always say, we are a citizens associations, and we work for the well-being of the population, and that relates to health, education, security. We try to see how we can come up with innovative ideas that are impactful ideas. For Hack for Wuhan, we had Maxime, who's our partner, who was affected by the lockdown, and his experience really helped diagnose me. As I said in my presentation, it's in times of crisis that we come up with solutions. This is why we decided to take part in Hack for Wuhan. Like many African countries, in Burkina Faso, our health system is not very resilient, and we had to come up with innovations to prepare our response to combat the disease. And so this is why we needed ideas of what to do to see how we could adapt the solutions that we came up with. So we built a team of engineers and doctors. We had an IT engineer, the person who is a student in Wuhan, and then we also had a civil engineering engineer as well. Okay, thank you very much. And how was it received? How was the solution received in Burkina Faso? Did you encounter any difficulties to roll out the solution? Well, I will let my partner answer that question. Emily, would you like to go ahead? The interpreter apologizes but cannot hear the speaker.
On a un petit problème de son.
So we're experiencing some sound
Émilie,
issues.
si vous pouviez juste vous rapprocher,
Emily,
parler un peu plus
perhaps
fort,
could you
parce qu'on vous entend
get
très
closer to
faiblement.
the microphone or speak more loudly? We can't hear you very clearly at all.
Voilà. Ce sera peut-être mieux comme ça. Ben voilà, comme ça, on vous voit ensemble, c'est encore mieux.
Yes, this might be better.
Alors, voilà, là, c'est bien comme ça. Voilà, on vous entend.
So we can hear you now. The red tape slowed down the use of the platform in Burkina Faso. We had to roll out promotion campaigns for the solution. Following the health caravan that we organized in Burkina Faso, we saw that there was an increase in the number of downloads of the application.
Poursuivre le débat un plus tard parce que après la présentation des autres startups, il va y avoir un débat avec vous tous.
So we'll be able to talk about that further later on because there will be a debate with all of the startups, but we can see that there is still a lot of work that needs to be done, and it is not easy to convince all stakeholders, and where you're working, you are faced with a number of constraints, and that's why it's important to have these types of initiatives so that you can identify partners that can increase your visibility. With visibility, and we can see this with Diagnose Me, and on that I want to thank you. It's a shame that this is a remote meeting because you should really hear our applause for your projects. Thank you very much, both of you, and we'll come back to you later on. And now we're going to move on.
Le fondateur de... Je sais pas s'il est connecté. Je l'ai vu tout à l'heure.
Mahmoud Belghith, the founder and manager of Smartbox. He was here earlier on.
Mahmoud, est-ce que tu nous entends?
Can you hear us? Yes, I can hear you.
Ah, voilà, super. Je t'avais vu tout à l'heure et puis là, j'ai vu que tu avais disparu. J'ai cru que tu avais perdu la connexion. Super, Mahmoud, qui est le fondateur, voilà, super, qui est le fondateur de Smartbox, qui est un projet, une très belle startup tunisienne, qui a beaucoup fait parler d'elle au début, finalement, de la Covid, hein, avec ce hackathon tunisien, le hackathon Covid Challenge, qui est organisé par une startup que vous avez remporté.
And you won
et qui en fait
this
propose
hackathon.
De transformer des containers maritimes
The idea of your project is to transform shipping containers into modular hospitals where people can be treated and cared for. Both of you have 5 minutes to introduce your company. Raouya Kria is with us. She's an architect.
Votre double regard.
And it's quite interesting to be able to listen to both your experiences.
Et puis nous aurons après 6 minutes de discussion.
And you want to show us a video as well, maybe? And we'll have some time to talk. Well, first, thank you for the invitation. Unfortunately, I'm on my own today. Raouya is sick. She won't be able to help, but I will say a few words about the technical side as well, because I'm a civil engineer. So I do take care of the technical and commercial aspects. So what is Smartbox? We specialize in modular building. We use recycled shipping containers. We are involved in different projects, housing. We worked with the military as well, with social housing. Now we are working more in the field of health, sorry, rather. So yeah, like you said, we won this hackathon, and the solution we presented was health units for screening and treatment. Because of the emergency of the situation today, the project was interesting because it's a solution that we can build fairly quickly. We have production capacities of 20 units a month. Another advantage is that these units can be moved around easily, and it's a lot easier to build than traditional buildings. And we wanted to develop this project to create these intensive care units that we needed, operating rooms, different places really, because the idea is that we wanted to be able to build a whole hospital, and you can use the different containers as modules that you can organize together. We wanted to answer the needs of our clients. So we can decide to add extensions to a building if we need to. In Mandela, for example, we built a mobile center, a hospital. There was a documentary by a channel on our mobile units. We have created many partnerships with Siemens, for example. It is the leader in medical equipment in Europe. It's a partnership to give us equipment, because if tomorrow, if you want to work with the government or NGOs, we need to guarantee the quality of the equipment, and we want to respect the highest standards. So this collaborative project is also a way for us to be able to commercialize our project through their clients as well. They've got a project with UNICEF, for example. So we have a production site in Tunisia right now, a second production unit in France. So we want to be able to be on the European market as well, and in North Africa and on the African continent as a whole. I want to share my screen if you don't mind, so I can start my presentation.
Oui, oui, parfait.
Wonderful. So these units can be used not only for COVID-19. This concept is useful for other pandemics. What we noticed is that there were issues for governments and NGOs because we were not prepared for the pandemic. And we do believe that our solution is very practical, that can be used today, but this can be recreated in the future as well, because there will certainly be other pandemics or other infectious diseases or other health issues. So this is the first prototype for intensive care. Usually we are told that shipping containers are too small, it's just a metal box. But we have worked a lot with specialized architects, and we asked doctors and healthcare professionals that were involved in the fight against COVID-19 what their needs were. So we did a survey on our side to understand the needs of healthcare professionals. We wanted to really understand the problems they faced to find the right answers. In terms of size, we respected the standards. We needed to respect different spaces. We needed to guarantee that the healthcare professional would be able to move around freely. You can see the entry on the left, and then there's another room in the middle. And this is a decontamination area. And then we have created a filtration system to avoid that the virus would spread. So there is an air filter, and we also developed starting from this unit, a whole hospital. So here you can see more information about the sizes. This is one of the units we built in Tunisia. So the container, if you want, is just a structure. Here, it's not been decorated yet, but there will be an inauguration on April 2nd. There will be experts from France as well, and people from the German embassy. Here you can see the decontamination area in the middle, the patient's room on the right, and on the left, the entrance. We made it so it would be easy to clean. We also have developed another solution, and that's the mobile consultation unit. You can see on the right drive-through for COVID screening. So the person inside the car doesn't even have to get out of the car to get tested. So again, this is a project to avoid contamination between healthcare professionals and people and patients. And this is quite useful because this unit can actually be moved around. We see that today some people do not want to go far to get tested, and we want to encourage people to get tested. So if we build these units and put them closer to some areas, people will be encouraged to go. And it will be easy for people to find new places to get tested. So this is a lab unit. Unfortunately, today the screening centers are overwhelmed. The capacities are not enough to accept everyone, and it will be worse for vaccination as well. We are talking about 60 million people in France for vaccination. So also another issue is where these centers can be built. So we have another solution here. Again with the containers, it's something that is easy to move around, easy to install, and it's cheaper. So the production capacity is 15 units a month. The delay for production is 30 days, production and delivery. We respect health standards, security standards, and these units can be used post-COVID. In the future, they can be used for other health crises, for example, and other things. So what are the perspectives for us? Well, we can develop a whole hospital, like I say. We want to guarantee that the healthcare professionals can move around freely. I wanted to show you some of the rooms. Here you can see on the right 4 intensive care units. We noticed that one of the main issues in the hospitals today is that hospitals cannot take care of patients that have other diseases, unfortunately, because COVID patients take all the space. So we want to create a COVID unit that is separate from the rest, so there will be enough spaces in hospitals to treat patients with other needs, and COVID patients can go to another place near the hospitals. And these COVID units will be only for patients, COVID-19 patients, and healthcare professionals specializing in COVID-19. Again, here are the units. You can see that there is a bigger room for COVID-19 patients. It's for 12 people, and it could be actually a little bit bigger, this kind of ward. Again, we have many projects, these intensive care units, the screening units, the labs. So really, we would be able to build a whole hospital. So here are some of our partners. Eurobiomed, for example, it's a startup accelerator specializing in health. And they've got a technical expertise that they are sharing with us. So we are in touch with healthcare professionals because we want to make sure our solutions are as professional as possible and can be used at an international level. There were, articles and such in different media on the internet as well. You can see the list here. And this is the last operation we are working on. We want to produce 2 different prototypes. There will be one in Marseille and one in Berlin. And we are working with Expertise France on one of these projects. Thank you very much for listening to me.
Bravo, bravo beaucoup.
Well, congratulations.
Merci beaucoup, Mahmoud. Bravo.
Congratulations and thank you, Mahmoud.
On voit une très belle innovation et on est dans de l'innovation,
just wonderful to
je dirais, partagée entre les deux rives de la Méditerranée. Et c'est illustré de manière
between the 2 sides of the
Mediterranean qui a été développée, innovée dans l'urgence à Tunis,
it's great to see that this solution that was developed in Tunisia is now used in Marseille, on the other side of the Mediterranean Sea.
Que moi j'aimerais te poser, c'est
And I have a question for you.
Cette innovation, ce Smartbox, c'est un peu un exemple de résilience partagée entre les deux rives de la Méditerranée.
Isn't it an example of resilience shared between the 2 sides of the Mediterranean Sea? Because both sides were affected by COVID-19. So my question is, are your daily activities impacted by the COVID-19 crisis today? I think it's important to know as well
par la crise.
What you've been experiencing as a company. Well, for us, the crisis was also an opportunity. We wanted to show that even during a crisis, we were present, we were useful. You may remember that there were terrorist attack in Tunisia some time ago, and we were present then as well. We work in different sectors. Some jobs were actually cancelled. So it had an impact on our finances. Some of our clients had financial issues. And some of our clients didn't pay what was owed. However, because the units are produced here, there is more security for the people who work at the factory. They don't have to move to a building site. So, of course, unfortunately, there were cases of infection, but we managed to keep things going with the people we employ. But sure, there were consequences on our company. And because of this impact, we had to find new markets, really. I have a question for you. So could these units be used for other diseases, like for an Ebola pandemic? Yes, when we started doing studies for this project with about 30 people, we worked with specialists in different fields: health, architecture, engineering. And like I said before, of course, we are now going through this COVID-19 crisis. But we think that these units can be used for other pandemics as well. I'd like to give you an example. For COVID-19, in terms of security and health measures, there needs to be a negative pressure to avoid that the air that is in the patient's room goes outside. But for other diseases like Ebola, patients are weaker and can be contaminated by other diseases. So it's actually the other way around. You need positive pressure. So you need to avoid for the air to come into the room. So all these technical issues need to be taken into account, but the solution can be adapted to different contagious diseases.
Je regarde si on n'a pas une autre question du public.
Is there another question from the public?
Non, on n'a pas d'autres. Eh bien, merci beaucoup, Mahmoud. Et je
thank you very much,
retrouve
Mahmoud.
à la fin des pitchs parce qu'on va avoir un petit débat
you will be back
et j'ai
with
d'autres
us
questions
at the end of the
vous poser.
presentations because there will be a
Merci beaucoup
debate.
pour ta présentation. C'est très beau
Thank you very
projet
much,
Smartbox.
Samir.
Et,
Smartbox is a wonderful
on
project.
se retrouve
Thank
tout à l'heure.
you, and you'll be back with us
Je
later
passe
on.
tout de suite la parole.
Thank you.
And
now I will give
Malik
the
Diouf,
floor to Malik Diouf.
Dakar, qui est le fondateur
He's
de
from
Africa
Dakar, and he's
qui
the
a
founder
développé
of
une
Africa
solution qui
Mobile.
fonctionne sans
They
Internet pour
developed
envoyer des
a
messages
solution
USSD,
that
des
works
messages
without
vocaux
the internet
en
to be able
langue
to send
vernaculaire
voice notes
aux populations, notamment les populations rurales, pour les informer
rural
sur le
populations to
virus.
inform them
Et
about
tu
the
as mis en place
virus.
un
And
portail
they also
gratuit ouvert
put
à tous sur le
into place
coronavirus,
a
quel
portal
que soit
which is
l'opérateur.
free to everyone,
Malik,
regardless of what
si tu
telephone
nous
operator they
entends,
are with.
tu as
Malik,
6
I hope that
minutes
you can
pour
hear us. You have 6
présenter
minutes to
l'Africa
present
Mobile.
Africa
Comment
Mobile
tu as eu cette idée,
and to
notamment
explain to us
la solution dédiée
where
au
the
Covid
idea
et
came
quelle a
from,
été ton
how is
expérience
it a
sur le
solution for
terrain
COVID, and what
aujourd'hui
was your
après un
in the
an.
field
Quel est ton
experience,
recul et
and
nous
what
expliquer un petit peu comment
hindsight
s'est
do you
passée
have after a
la mise en
year?
pratique de
And can you also
innovation.
talk to us about how
Malik,
you rolled out the
si tu...
innovation? Malik, you have the floor. Thank you very much, my friend.
Très
Can
bien.
you hear me well?
Très bien.
Very well. Thank you. This may be short. I would like to thank Univers for the invitation. Thank you very much for asking us to come along to talk about what we do. My name is Malik Diouf, and I'm the co-founder of Africa Mobile, which is a Pan-African SME, which seeks to support African companies to do marketing on mobile phones. At Africa Mobile, we are convinced that by helping companies to better target and to better communicate around their products, their mobile services, where most of the African customer base is, then we can continue to develop and thus continue to contribute to the development of the African continent. How do we do this? Well, we work with telephone operators who are making their infrastructures available for us so that we can make a platform available to our African customer base. And this enables them to obtain simple SMSs, text messages in local African languages. So we're present in 10 or so African countries at the moment. And last year, in 2020, we sent more than 50 million text messages to the entire continent. So where did the idea come from, the idea of the project? Well, very simply, as it stands, there are two major facts or factors in Africa that must be taken into consideration for anyone who wants to implement a digital solution. The first thing is that, unfortunately, the African population is not sufficiently connected. There is more than 40% of the African population that is less than 40% of the African population that is connected to the internet. The second thing is that they don't fully harness it correctly. Half of the population in Africa knows how to read or write. And so based on this, when you roll out a digital platform, you have to ask the question, how can I reach the population, the most pertinent population? Therefore, at the outset of this pandemic, and Madame Ngoni mentioned how alarmist it was at the beginning. The first thing that we asked ourselves is, what can we do in concrete terms? We're not from the medical field at all. We're marketers. But we did wonder, what can we do to try to make our systems more adaptable in order to help the authorities and the populations to find a solution to this? The obvious solution was that we had the possibility to help when it comes to communication and awareness raising. And we basically rolled out a very simple experience in the few regions in Senegal. We asked people to go to the health ministry's website. We asked 14 people to do this. And out of the 14 people, I think 1 or 2 people managed to really get to the website for a number of reasons. The first reason, I mentioned this earlier on, was to do with internet connectivity. The second reason is, well, typing in the words Ministry of Health for people who haven't been schooled. That can be something that's quite difficult. And so we did ask these people, these 14 people, can you access a mobile payment solution via technology, which is USSD technology. Out of the 14 people interviewed, almost 12 of them managed to access the mobile payment service. And so in the end, we realized that it's great to have apps and websites, but less than 10% of the population can really access these sites. However, with USSD, more than 80% of the population are able to access these services. So based on this observation, we knew that we will be able to make available a USSD code, a very basic code that everyone can use, that will enable people to very simply type in this code and to find out all of the health crisis information. And so this is how we were able to reach all of the lower end of the pyramid, if you wish, that needed that information. And the solution was used by more than 2 million Senegalese people that would check the health crisis information regularly, information about COVID in particular, because quite simply, as we have been saying, and I'm very impressed by the capacity of the entrepreneurs that we just heard from, their ability to provide practical solutions. To be humble, we are not as committed, let's say, as those people, as the people we've just heard from. But with our very small contribution, we were able to share information and raise awareness. I would like to show you a brief presentation just to remind you who we are and how we rolled this out in concrete terms and what the impact it had was on the Senegalese population. I'm now going to share my screen, if you don't mind. So here is the screen. Here is my screen. I just want to show you this video, which shows us and explains to us who Africa Mobile is. So stop COVID. Together we are fighting against the coronavirus. Africa Mobile is a mobile marketing platform in Africa based in Dakar with offices in Mali, Guinea, Niger, Benin, Burkina Faso, Burundi, and in France. At Africa Mobile, we work based on 4 channels: SMS, USSD, vocal, and airtime. This is great, but how does it work in concrete terms? Let's use the example of USSD, which is a mobile solution that makes it possible to offer a number of services without internet connection, regardless of the type of mobile phone, whether it's a smartphone or not. In Africa, we use it mainly for mobile money, mobile banking, e-commerce, and a number of other things. We used USSD during the lockdown period to provide, in just a few clicks, essential information on the pandemic for all of Senegal without the need to connect to internet. It's a solution a rapid solution that can be used via our code, #2121#, and you can obtain all relevant information on the coronavirus in Senegal. This service was used to inform more than 1 million Senegalese people about the health crisis. This is a major innovation that encouraged the health ministry in Senegal to create its own code 2930. So the voluntary contribution of Africa Mobile will help to fight against the pandemic, because we believe that awareness raising is one of the keys in the fight against COVID-19. With Africa Mobile, you can create links with your clients and your customers on their mobile phones. So very quickly, Samia, that is what we did. But before I conclude the presentation of the actions that were undertaken by Africa Mobile, I'm also part of the TIC in Senegal, and we had a huge mobilization in Senegal that was called Fight COVID. And we really saw all stakeholders from Senegalese tech. And our initiative joined that collective. And so the tech community in Senegal went to see the health ministry, listened to the needs of the health ministry, and was able to provide concrete solutions, as you have just seen. But also, we were able to trace infected people. We were able to manage and help manage the pandemic. Eon, which is a startup, also created a medical passport, which is still functional in some areas of Senegal. And all of this was done voluntarily. And so this demonstrates to what extent civil society, entrepreneurs, tech has been able to contribute and provide pragmatic solutions that have made it possible to fight against this pandemic. Thank you very much for your attention. Thank you.
I think we lost Samir. Where is Samir? Malik, don't worry. Samir needs to take care of a few technical details on Zoom, but he will be back in a few.
J'ai été déconnecté.
Yeah, sorry.
C'est la musique sénégalaise. Je me suis envolé vers Dakar.
I really enjoyed the music, so I took a trip to Dakar for a second there.
Ce que j'ai retenu, ce qui m'a frappé, Malik, c'est
what I got
dans
from
la
your
vidéo,
presentation, Malik, in the
video,
video,
détourné l'usage
is
de
that
la technologie
you
du
said you
SSD.
diverted
Vous avez
the
hacké quelque part
USSD
cette
technology,
technologie
you
pour en
hacked
faire
in a
un outil de
sense this
e-santé.
technology
Et ça,
to
c'est
use
vraiment
it
très fort,
as
parce que c'est
a
ça, en fait, l'essence
e-health
de la tech
tool.
africaine et ce
And
qui
that is
motive les
why
startups
African
africaines.
tech
C'est là
and
où on
African
n'arrive pas à trouver des
startup companies
solutions
are
avec
so strong,
les contraintes du
because
quotidien,
you need to take care and you need to take into account
qui sont insuffisants. On sait aujourd'hui
daily
que la puissance publique
constraints to
n'arrive pas à
find
résoudre tous les problèmes de
solutions.
santé.
You find
Les entrepreneurs,
solutions
avec ce
to
sens de
issues
l'innovation,
that
avec ce
public
sens
authorities
c'est
do
hacker,
not
mais pour le
find
bien commun,
answers
c'est pas
to,
du tout
and you do it for the good of everyone.
de la cyberattaque, c'est de détourner
It's
la
not a
technologie pour
cyber
le bien
attack. The
commun.
idea is to
Tu es
divert
parvenu
the
avec
traditional
Africa Mobile,
use of
finalement, à
some
toucher
technologies to
des
find
millions
solutions.
de
And
Sénégalais pour leur apporter cette
millions
information
of
sur le
Senegalese people
coronavirus.
were able to
Autrement, ils
access
n'étaient tout simplement pas
information
sensibilisés
thanks to
là où
you,
ils étaient,
and
dans
you
les
really
territoires les
managed to
plus
raise
reculés.
awareness
Alors,
on
juste
some of these
rapidement, est-ce que tu as justement des
quickly,
chiffres
do you
pour
have a
illustrer
few numbers
ton innovation, à nous communiquer sur la portée de ton action face au Covid
describe your
ont été envoyés
actions,
par l'Africa Mobile et combien de personnes au
how
total
much
ont
information
pu être
was sent
sensibilisées.
through
Je
Africa
sais qu'on en avait
Mobile, how many
parlé, on s'était
people
vu à Dakar ces dernières semaines.
got
Tu
the
m'avais sorti des chiffres
information.
absolument impressionnants.
I
Aujourd'hui,
remember
où est-ce
we
que
talked
vous
about
en êtes?
this, the two of us. So can you tell us a bit more about this? Yes, 1 million people. Actually, we were actually really surprised ourselves. So we didn't really communicate about the product. It's just people talked about it to each other. So maybe we didn't raise awareness with the whole population. We wanted to talk to younger people. I think there was really a peak at the beginning. We just thought, okay, this is a way for us to contribute. This is something we can do to support what was happening. But it was so popular that we had to talk to the Ministry of Health. We had to coordinate with another COVID-19 initiative that I mentioned before. So not all startups were involved. We worked with some telecom operators. The interpreter apologizes, but it's hard to interpret because we can hear Malik through Samir's microphone. So we managed to raise awareness on these issues thanks to this tool.
Alors, il y a beaucoup de bravo en ligne, il y a beaucoup de commentaires.
So we have a lot of comments online, a lot of people saying bravo, and lots of people who are asking questions as well. Any reactions? Perhaps I'm going to try to see if we can take some questions. And so this is really a magnificent initiative. You are able to fight so many things. So you said that in the video that you used USD, you were able to reappropriate a USSD. And I think this is a positive thing. I don't think this is negative. And so you were able to harness technology in order to reach a greater amount of people. What is your view? So you mentioned hacking. Sometimes we use words and we associate them to negative things. Innovation is just that. The way that people see things, or use things, if you can take that thing and readapt its use in order to give it a new vision. And I think that that is what most people who are here today think. I listened very carefully to what Mahmoud was saying earlier on. And obviously, this solution may originally been aimed at your average Joe Bloggs, but what happened is that we had to take a step back and to see whether this solution could actually be a solution to the current issue. So the idea to really understand, the idea was to innovate. Let's say to innovate. We wanted to innovate and take its usual use to use it in a more specific way in order to respond to a very specific issue. Thank you very much, and well done. Thank you very much, Malik. I think that you deserve a round of applause, and I will come back to you later on. Thank you very much, and thank you to Malik. And now I am going to introduce Cédric Degbo, who is the founder of REMA. If you are here, Cédric, if you are connected.
Donc, le fondateur du réseau d'échange entre médecins d'Afrique, une plateforme collaborative,
and so
une plateforme
you are
participative
part of
qui permet en fait
the exchange network between
d'échanger, de
African
collaborer, de
doctors,
partager les bonnes
and it's
pratiques
a
grâce au
participatory
digital.
platform that
Je pense que
enables
tu as
you
une
to
présentation, tu
share
as 6
good
minutes pour nous
practices. I think that you
présenter
have a
ce que fait
presentation, so
REMA au
you have
quotidien.
6 minutes to explain what REMA does on a day-to-day basis.
Lis ce que j'ai écrit là et tu me dis s'il manque. I hope you can all see my screen. I will now start my presentation. Hello, I'm Cédric Degbo. I'm a doctor and a founder of the REMA network. You know, malaria and HIV are now recognized as some of the deadliest diseases in Africa, but medical errors today cause twice as many deaths. One medical decision on two is a medical error in Africa, and apparently it kills someone every 30 seconds. So it was more than malaria in 2016. So there are limits to the organization of the system, but data show that this is due to the lack of information, the isolation of doctors, the medical deserts. Africa is still considered to be a medical desert, and it's also due to a lack of means of communication between doctors on our continent. When doctors have issues, they can reach out to colleagues in the same hospital if this doctor is lucky enough to work at a hospital, or they can reach out to the doctors they know. But as a doctor, I can say that it's not enough, because usually doctors don't find the answers they need or the medical expertise they need in their own network, which can have bad consequences on the patients and on the doctor as well. So we decided to create a solution, and that is REMA. The goal is really to improve medical decisions. It's to create a network of doctors that can share their knowledge, their experience. They can discuss patients, and there is a real-time messaging system, an exchange system. So the goal really is to create a network of doctors in the app. And we hope that thanks to the experience of other doctors, doctors can really find the answers they need when they are dealing with a patient and something they don't know. So what is REMA today? It started in 2017. So we've been on the market for a couple of years now. And it was made for a community, and now there are more than 10,000 users from different African countries, especially French-speaking African countries. And we are present in 5 countries, in Benin as well, because we're from Benin, in Togo, Mauritania, Cameroon, and Senegal, most recently. So there is a community that is active and growing of healthcare professionals, thanks to the REMA network. REMA is also a tool for institutions and for communication. It helps organizations. How can I put it? It helps governments, medical institutions, pharmaceutical companies to communicate better with healthcare professionals in Africa. So the app can be used to disseminate information in real time, scientific information or commercial information, so it can be used to reach out to healthcare professionals on the continent. And quite a few organizations are using the app, and even governments, they trust us. You can see a few of our partners here on the screen. And on March 16, and since March 16, we have decided to use this institutional communication tool to give it freely, to guarantee its use freely for government and different institutions so that they could better deal with the COVID-19 crisis. The idea was to inform in real time healthcare professionals about COVID-19 issues. And thanks to the app, human contact can be avoided. And also we wanted the information shared to be as based on fact as possible to avoid people to worry. So different health ministries used REMA, and what they are trying to do today is to first detect contacts, also inform population, and the third mission is to inform and coordinate the whole healthcare community on a national level. And that is why REMA is useful. We have created a new solution, a business solution that could be used freely, and that can be used freely. And Côte d'Ivoire integrated it into its strategy at a national level, and the Health Ministry of Senegal, through its initiative, used REMA as well. And my colleague Malik mentioned it before. So REMA is also part of the collective that was mentioned before that fight against COVID-19 in Senegal. I would like to finish on this note. Our mission was firstly to fight against medical errors. And according to IOM, most people will be faced with medical errors in their lives. And that is why me and my colleagues are fighting against this and are involved in this project. Thank you very much for listening to me.
Merci beaucoup.
Thank you very much,
Cédric, pour ta présentation vraiment inspirante,
for this
pour aussi
inspiring
ta
presentation.
motivation, parce que je sais que tu l'as
Thank you
pour
for
le
your
terrain depuis bien
motivation.
longtemps avec cette solution.
You have been working on this for a long time. I
N'est pas
know.
né avec le Covid. Le
But the
REMA
solution
travaillait avec
wasn't
les professionnels de santé
started
bien
with
avant
COVID. You were
la crise
working
sanitaire
with
internationale.
healthcare
En quoi
professionals
cette
a
crise
long time
Covid
before
a
that.
changé la donne pour toi?
So how has COVID-19 changed the game for you? Well, the COVID-19 crisis has changed different aspects of our business. It's changed the situation of the healthcare professionals that we work with. About the users, there are actually more users now. The numbers have doubled since COVID started. So we were actually doing some experiments on the platform at the moment, and we noticed that most conversations were about COVID-19. Also, there were also new users more generally on the platform. So there were a few changes when it came to the number of users. And also, we noticed that healthcare professionals were really using the network for different purposes, because medical companies, for example, had to adapt to social distancing, for example, and they needed to find new ways to work, and they used our solution for that. So it has changed the situation for us. That's what has changed for REMA and the way it is used.
Il y a déjà des réactions, notamment
some people are reacting right now. Some people are shocked by the numbers that you presented about medical errors. There is a question: are you supported
l'OMS.
By WHO, as WHO reached out to you? No, we are actually trying to see how we can work with WHO, because it's not that easy to work with them. Yes, we do not work with the WHO, but we work with other UN partners like UNFPA or the World Trade Organization, WTO. But if you know people who work for WHO, well, just tell me.
Le message est lancé.
Well,
je pense que l'univers science peut aussi
thanks a
aider
lot.
à ce
Maybe
rapprochement-là.
Univers Can help you with that. I've got one
qui sont
last
aujourd'hui les
question.
professionnels qui utilisent le
Today,
plus
who are the
les professionnels de
professionals
santé qui utilisent le
that
plus aujourd'hui ta plateforme?
use RIMA a lot? Well, to answer that question, it's important to remind you of RIMA's mission. The idea was to guarantee the security of patients and guarantee the quality of medical decisions. So who coordinates treatments and care? Well, doctors, they are responsible for diagnostics. So at first, the platform was open only to doctors. They were our main users. But with COVID-19, we realized that doctors are not the only ones at the forefront of the struggle. Nurses as well are present. So we decided to open the network to nurses and other healthcare professionals. And UNFPA has really collaborated with us, and they helped us reach out to midwives all over Africa so that they could join the network. So there are three professional categories right now: doctors, nurses, and midwives.
Eh bien, merci beaucoup Cédric, merci beaucoup pour ton témoignage.
You,
je vais revenir un peu
Thank you
tard
very
vers
much
toi
for
et je vais tout
your
de suite
testimony.
accueillir une entrepreneuse qui est la fondatrice de Senvital,
But now we are
welcoming
Caroline
Ndiaye
Ndiaye
un passeport
from
universel de santé
Senvital
qui
is
permet
a health
d'accéder aux informations médicales des patients de manière instantanée.
passport
Est-ce que Caroline est parmi nous?
gives access to medical information. Is Caroline here? Caroline has connection issues. She is a little bit late.
Très bien. C'est ce que je
Okay, that's
disais,
fine.
parce que je l'avais vu se déconnecter.
I did see
J'avais un doute.
Caroline
C'est pas grave.
log
On va
off, so
passer
I wasn't
directement
sure, but that's okay. Let us move
symbole
on
anglophone de ce panel
to
avec
the
Price Pali et
English-speaking
deux entrepreneurs
part
nigérians,
of this panel. We
Luther
have
et
two
Moussomola.
Nigerian participants.
Welcome back. Very happy
Luther,
to be with you.
welcome back, and
la
also
majorité
Mosumola, hello. I'm going to continue speaking in French because most of our participants are French-speaking. So you developed Price Palais, which is an agricultural solution that enables people to better pay farmers by offering competitive prices, and you were able to adapt this solution to the COVID-19 crisis, and you were able to overcome some of the obstacles as it relates to lockdowns and curfews that affected entire cities. Some farmers could not sell their stock in the cities and in markets.
So present your project, and then I will ask you a few questions for another 6 minutes.
Okay.
You can go ahead, Luther.
Okay, thank you very much. I was for the introduction. My name is Luther. I'm the CEO at Price Valley, and my colleague is also here. Mosun, who is co-founder. Mosun, you want to introduce yourself?
Hello, everyone. My name is Mosumola, and I'm the Chief Data Officer at Price Valley. It's good to be here.
Okay. So do we do introductions or sorry?
No, go ahead. No.
Okay, so well, I've been to briefly talk about Price Valley. We started in November 2019, and the main goal then was to help, consumers reduce the cost of food, because food is very expensive in this part of the world. So our model then was to, bring people together so that we can buy together in bulk and split those bulk prices such that people are able to buy at wholesale prices for their retail needs. So we were able to do that. And a couple of months after that, COVID came. So when COVID came and everything was disrupted, it enabled us. I mean, what we already built was very, useful for the market, because we were selling food at fair prices, given the fact that we're able to aggregate demand. And we're also able to serve people in that period, because we had a government clearance to deliver to people. So we just came, Price Valley became like an intervention for that period of time when everything was disrupted. And we were able to, look out for supplies. Basically, when COVID came, it hit a lot of operations. Some farmers were not able to produce or even move out their goods at good timing and all of that. So we were able to enable these farmers be able to do that. We were able to look out for other sources of food items within the states and not too far from from where we were, so that the supply was guaranteed. So that was how we were able to intervene during the COVID period, and we've continued to do that even after COVID is gradually abating. So that will be all for my for the introductions.
Thank you. Maybe Mosumura, you want to add something?
Well, my co-founder has said it all, but I'd just like to add that what Price Valley has really helped us do is that it has helped us to the way we've been selling food at bulk prices and enabling other people to share. It really helped us to know how people like to buy food, and how to also understand how the seasonality of the food, and how to also solve some particular problems that we've encountered as a result of this past almost 2 years of doing this business. So I just wanted to add that to what he said. Thank you.
Merci beaucoup. Merci. Je vais poser la première question.
So I will
avec la
ask
mise en
the
place
first question.
donc vous avez expliqué à quel point avec les confinements, les activités
So you
quotidiennes
explained to what extent the
des
lockdown
producteurs ont été
was
bousculés,
really very restrictive.
disruptés même, pour poursuivre vos activités face
and
à
it was
la
difficult for them
pandémie
to continue their
et
business
permettre
when faced with the pandemic,
aux agriculteurs
and to enable
de
these
maintenir leurs
farmers
revenus,
to
aux
maintain
consommateurs
their
d'éviter les lieux de
income.
rassemblement.
And
Qu'est-ce que vous
what
avez mis en
did
place
you implement?
précisément
What solutions,
avec Price
concrete
Valley?
solutions
Est-ce que vous
did
pouvez
you
le
implement
décrire
with Price Valley?
pour
And can
que
you describe those
tous
solutions
ceux qui
so
nous regardent
that
comprennent
everyone watching can fully
comment ça a pu se
understand
mettre en place en si peu
how
de temps, parce
you
que
were
les
able to
confinements
implement
ont
this
été
in
mis en
such
place en
short
quelques
time,
jours, quelques
because
semaines.
the lockdowns were implemented in a few days, for a few weeks, in fact.
Yeah, Mohsen, do you want to take that, or did you get the question?
Yeah, I think I got the question. So when the lockdown had lots of negative effects, it also has positive effects as well. So I'll just start with the positive effects. The good thing about the lockdown is that because people couldn't go out, they were forced to order online, and since we're an e-commerce platform, we had lots of orders coming in because people couldn't go out to make those orders. So what that did was that it pushed us out into the limelight. So more people knew about Price Valley, which was the very good thing about it. And then, but the negative effects of that was that because of the lockdown, most of our food sources were shut down, and then some people couldn't deliver in their normal capacity. So what that did was it affected the prices of food, and a lot of food also became scarce as well. But because it was a challenge for us, we began to find ways on how to overcome such problems. we had to begin to look out for, because majorly food comes from the north in Nigeria. That's where the farmers come from. So majority of all food items come from the north. But because of this COVID-19 lockdown and the fact that food couldn't come in as regularly as before, we had to begin to search for farmers which were in the south, which are close to us, and also find a way to encourage these farmers to produce for us, and then to produce food for us, and also encourage them on kind of foods that we need. And another good thing that happened was, because of the lockdown, we had a lot of demand for certain foods. So it was easy to encourage these farmers to grow some particular foods. So that's basically what I would say. Luther, would you like to add to that?
Okay, yeah. So some of the systems we created, like she rightly pointed out, was the fact that we first we had to look out for suppliers who were closest to us, like farmers who were closest to us. Some of these farmers were really small, older farmers who we didn't were not looking at before COVID. Most of our supplies was coming in from the north, because that's where the major farming operations go in Nigeria. So we had to start looking closer. And some of the things we did looking closer was to map out, farmers who are close to us in Lagos and just outside of Lagos. And because of that closeness to us, we were able to move these items, because it was short distance. And we also had the government backing to move around, because we are an essential service. So that was how we were able to an extent, be able to supply food items to people who needed them. But even after COVID, we've continued that model, because we see that it's more sustainable, it's more resilient, in the fact that, yes, we do source from other parts of Nigeria, in the northern part of Nigeria and all of that. But because of what COVID has taught us, we are seeing a hybrid situation where we look at for sourcing, to source food items close to us, and also those are far off. But our model practically helped, in the sense that we actually bring people together to buy these food items. So it's usually in bulk. So most of the time, once we have a bulk item, we can always directly collect most of the time the harvest the farmer has. We are able to make most of it. We're able to buy off most of it. So that pays off farmers in a sense, and that really paid off during COVID period, because of, it paid off the farmers that we were able to reach at that period. I would say that, yeah, COVID had a very, very drastic effect on the system, but it has also taught us on how to, be nimble and be able to, walk around supply as quick as possible. So that's what I would put it as. I don't know if we answered the question very well, but that's like what we experienced.
Ma seconde question est, selon vous,
est-ce que le Covid,
quelque part, a renforcé vos activités?
Strengthen for businesses?
Sorry, come again. I didn't get that. Sorry.
My question is, does the COVID, in a way, reinforced your activities?
Yeah. Yes, definitely. So COVID, enabled us to look deeper into our model, because if a situation like that comes up again, we need to be very much prepared. So some of the things COVID taught us and really highlighted was the fact that we need to know where these food items are coming from. Majorly in the markets in Nigeria, local markets, you hardly know where your food items are coming from. There's hardly a traceability angle to it. There's hardly the safety angle to it as well. So COVID has reinforced that. Number one, the safety aspect of it. And number two, the traceability. We have learned that it is super important to be able to trace these food items. It's super important to keep up with the safety regulations that, COVID highlighted during the COVID period. And even our operations, we because of the demand that we got during that time and following that time, we've been, optimizing our system such that people can get their food items as fast as possible. So right now we deliver between, within a day, within 24 hours. If you make your order today on Price Value, you are getting it the next day, as long as you are within the areas that we deliver to. So COVID helped us push ourselves to that extent. So many of our processes are now very ingrained because of this experience with COVID.
Thank you very much. I will come back to you a little bit later with a few more questions. And thank you for this very inspiring project, startup, innovation, and a pure example of resilience. Thank you very much.
You're welcome.
Je vais maintenant demander à Caroline.
I'm going to ask
si
Caroline.
Revenue.
I'm going to check whether she is back. Is Caroline Dye with us? No, she is still not here. She's still not here. But
alors,
she will be here shortly.
C'est pas grave parce que j'aurais aimé
that's
poser
fine,
une dernière question
because I actually wanted to ask another question to the previous project, if you don't mind. A project which is very interesting.
Because we're still waiting for Caroline, I have one last question, Luther, because your project is very, very interesting. Did you receive any support from authorities, government, because we had a lot of intervention, previous speakers saying that they were basically on their own during this. They tried to collaborate with the Ministry of Health, but it's very experimental. Did you manage to connect with the authorities and receive some support?
Yes, so we did receive some support. Well, basically from the state government of Lagos, where we are. So around that period, getting food was a big concern. So the state themselves had to look out for solutions that could help at that point, and we were just in time. Just in the right position to help. So the support we got though was that we could move around, for deliveries. It was quite significant because it helped us to be able to reach people that wouldn't have been reachable, if I can put it that way. Yeah, so we did get that.
Thank you very much. If Caroline is not there, I will finish by one last question. You have heard 4 previous projects from Francophone Africa. Can you imagine some collaboration with some of them?
Yes, definitely. So we are looking to not only serve, states in Nigeria. We are looking to, move to the east and the west and south of Africa. So definitely from, some of these projects I've listened to have the same experiences with us. Some of them have similar models and all of that. So definitely it's very, in the near future, we'll be looking out for partnerships in these other countries where they can help us with local knowledge of how to, get things done in those countries. So definitely, yes.
Okay, thank you. Thank you. I think Caroline, je pense que Caroline n'est pas encore arrivée. Je pense que c'est un problème de connexion Internet. C'est une vraie problématique à soulever d'ailleurs Malik tout à l'heure. Et je pense qu'on va passer directement à la conclusion, ou en tout cas au débat conclusif. C'est les enseignements de cette pandémie et aussi comment se projeter dans le futur. Et je vais commencer par poser ma première question qui va s'adresser finalement à vous tous, mais je vais commencer par toi, Adama. Aujourd'hui, si tu es toujours avec nous, je l'espère. Vous avez
Yes, I'm still here.
Avec ta collaboratrice, vous avez modifié un peu vos activités au quotidien face à la pandémie. Vous avez développé de nouvelles solutions, de nouveaux modules. Que va-t-il rester, et surtout, vous êtes vraiment de plein pied dans le digital, que va-t-il rester selon toi de ces évolutions dans ce qu'on appelle le monde d'après? Est-ce qu'il y aura un retour en arrière ou est-ce que cette digitalisation accélérée est faite pour et il n'y aura plus de retour en arrière?
Means that there will no longer be a going back. Well, the pandemic did mean that we had to change our habits. Can you please mute one of your microphones, please? We have a lot of echo, so can you mute your colleague's microphone? So, as I was saying, we have changed our ways of working. We work remotely more. Digital was very effective in this period. It enabled us to take very quick decisions. And so, we believe that this is really an ideal period. I think we have to harness digital technologies to be able to better contribute
Cédric,
to the fight against COVID-19. Thank you very much, Cédric. What do you think about digitalization? Do you think that it has made it possible to speed things up, not just in healthcare, but in education, in farming? Do you think that this digitalization is unstoppable? Has it meant that we have been able to make progress in terms of remote consultation in medicine and other fields?
Est-ce que Malik est là?
I fear that Cédric is not here. Is Malik here? Yes, I am here. I am here. I have a similar answer to Adama. One of the major issues that we encountered when we launched the Africa Mobile project is the teaching aspect, how to explain to the population what impact digital technologies can have on our day-to-day. And even today, we're still raising awareness among the population because people are struggling, imagining and understanding what the role of digital technologies is. And I think if there is a silver lining of this pandemic, then I would say that it is the fact that thanks to all of the solutions that we've talked about today, thanks to all of the initiatives that we've discussed, people are now aware, in any case in Africa, of the importance and the important role that digital technologies can play in their lives. So I think that as soon as you demonstrate the advantage of digital technologies, as we have done, it will be difficult to go back. We see at the moment that there is a technological leapfrogging that is happening in Africa. Even in these conditions amidst this pandemic. But I do believe it has enabled us to make a leap forward, and I hope that people will have understood that and that we'll start to think more about digital technologies and how those technologies can be rolled out in their day-to-day lives.
Merci beaucoup, Malik.
Thank you very much. Thank you very much, Malik.
Mahmoud, si tu es avec
I'm
nous,
going
Mahmoud.
to ask the same question to Mahmoud. Are you still here, Mahmoud? Yes, I am here.
Aujourd'hui, selon toi, cette accélération, quelque part, le Covid est un accélérateur de digitalisation, d'agilité aussi. Est-ce qu'on est dans quelque chose, si on prend aujourd'hui la Tunisie, est-ce qu'on est dans quelque chose qui est irrémédiable ou on va peut-être, après la crise, après la pandémie, on va peut-être se détourner à nouveau du digital? Pour toi, ça y est, le wagon est lancé et on ne pourra pas revenir en arrière.
I think that's it. I think things are in motion now. Alternatives already existed before. It was just that there was no opportunity to really roll them out. But now I think that there is no way that we can turn back. And we have proof now. And this is why I think we can build on this momentum. This is just my personal opinion. But I think the train has left the station. And so, on the contrary, I think that things may even speed up more.
On a beaucoup parlé du soutien des autorités. Par exemple, Luther a expliqué que tout de suite, le gouvernement, ou en tout cas le gouvernorat de Lagos a tout de suite compris à quel point son innovation pouvait résoudre ce problème d'écoulement de bruit et tout simplement aussi de sauver les marchés informels. Est-ce que votre innovation, elle a tout de suite, et tu en as dit quelques mots tout à l'heure, les autorités ont tout de suite perçu la valeur ajoutée que vous aviez et quelque part essayer de vous intégrer dans la chaîne de valeur de la chaîne hospitalière, de la chaîne des services de santé publics? Est-ce qu'aujourd'hui vous êtes dans un partenariat réel avec les autorités?
Do you have a real partnership with public authorities? Unfortunately not. It's a delicate issue. It's health, and so the procedures are very complex and time-consuming. We have not yet worked with the public authorities. We are also encountering difficulties contacting the public authorities. There are other channels that we can take to share our ideas and to get them onto the market. However, none of this has yet been approved by the government.
Très bien.
And I think that's what's missing, in fact. That's what's missing.
Absolument. On va revenir notamment avec Cédric sur aujourd'hui comment est-ce qu'il a réussi quelque part à convaincre les ministères de la Santé. Je demande juste rapidement, est-ce que Caroline
I just want to double check before we do this. I just want to see whether Caroline is with us or whether we will have to continue without her. Yes, I'm afraid you're going to have to continue without her for the moment. If she does join, then
Alors,
I
Cédric,
will let
moi,
her in immediately.
La question que j'aimerais te poser, c'est
en termes de bonnes
pratiques par rapport à tous les projets que tu viens d'écouter. Tu es là, Cédric?
Are you still there, Cédric? Yes, I am here.
Est-ce que ces projets, tu pourrais collaborer avec? On voit que avec ta plateforme, tu es un agrégateur de solutions médicales. Quels sont les projets avec lesquels tu pourrais demain, quelque part, interfacer ta solution avec telle ou telle solution et la proposer sur ta plateforme?
Collaborate with some of these solutions? Could you offer some of these solutions on your platform? Well, first and foremost, we are really into peer-to-peer collaboration. And we also want to work with health institutions and ensure that they are in constant contact with their health professionals. And so with our remote consultation platforms that health professionals need, we believe that in the future, we will be able to create an interface between these solutions so that we can ensure that our community can benefit from it. And we also want to try to widen the spectrum, if you will, the spectrum of professionals available to the population. And so this, I think, would go well with the first solution that was proposed. I think it was a Diagnose Me.
Diagnose Me, tout à fait.
Diagnose Me, that's correct. And so we could potentially collaborate with a solution of this type.
C'est tout l'intérêt de ce type de rencontre, c'est de susciter des partenariats.
And that's the point of this meeting, is to try to generate partnerships. And what's more, they're both French-speaking countries, so I believe that it could be very interesting if we could continue this dialogue beyond this day. Obviously, this is a remote meeting and it has its limitations, but I do think that there could be a very interesting interface, particularly since you're in geographical areas that are very, very close. I have a question for Malik before I move on to the next question. In concrete terms, Malik, when you take a look at the impact that you were able to have in just a few weeks, in just a few months, what would you say for the upcoming year are the projects you're going to roll out? Do you have a roadmap so that you can scale up even further and go beyond the Senegalese borders and to work in the region, in particular with the early alarm, the alert system that you've implemented for COVID? Thank you very much for the question, Samir. To answer the question, I'm first and foremost going to start with the entrepreneurs that we have here. Rema, for example, Adama's solution. These are apps. online apps, and often they're mobile apps or websites, interfaces where the public needs to go. And as I said at the beginning, the issue with connectivity is a major issue, and I don't think we'll be able to resolve it very quickly. We will be able to provide support for these types of solutions, and we will be able to adapt these solutions to those areas that aren't very well connected with all of the solutions that we mentioned. So USSD in particular. We have the interactive vocal servers as well in the local languages of those countries. And this will make it possible to really reach those areas. We are already present outside of Senegal. We carried out an experiment in Senegal, but we're now present right across French-speaking Africa, including in Burkina Faso and in Benin. And the idea is to take a look at these entrepreneurs and these startuppers who have solutions and who can have a real impact. And we need to see how we can really ramp up and amplify this impact. Let me give you an example of a Senegalese startup which had a mobile app. It was a type of medical passport that Caroline was going to present. But the target was the target group was very specific. So when we started to work with them on the project, it took a lot of time. So we work with many startups. But what we do is we do co-construction. So we work together. We take the time to listen to them, to see what solutions they have, and then to adapt that solution to make it possible to have a greater impact. And so this startup came to see me. They said, we are targeting a number of healthcare professionals. And at the time, they were sending us 200 to 500 messages. They were sending that many per month. And now they are present in Senegal, Côte d'Ivoire, and Cameroon. And they send over 30,000 messages per month. And so this is an increase, it's been times by 10,000 over just 2 years. And so I hope that these entrepreneurs, after this meeting, will be in touch so that we can continue our dialogue and so that we can find new ways to collaborate so that we can increase the impact on what we're currently doing.
En tout cas, on sent cette passion et
in any case, we really feel this passion and this desire to really think outside the box, and we can see the different approaches between REMA and Diagnose Me, but the objective is to ensure that people contact you. Your information is available on University Science's website. Please do not hesitate, because these are innovations that need to be promoted, and above all, I think that these innovations can really teach us a lot. They can teach us a great deal, and we have Caroline who is here now. Caroline, can you hear us now? I think that you are with us. Caroline, are you there? Hello.
Écoute, Caroline, tu as
Caroline, you have 6 minutes to present your solution. The floor is for you.
Autour de Scène Vitale maintenant.
And you're going to be talking about Scène Vitale. Just bear with me 1 minute.
Caroline, tu t'es coupée à nouveau.
Caroline, we seem to have lost you once again. I think you were trying to share your screen, is that correct?
Caroline Dye, est-ce que vous nous entendez?
Caroline Dye, can you hear us?
Mark Eden, elle est...
Mark, is she still with us? I'm here. I'm just trying to share my screen with you.
Je crois que... C'est bon.
Can you see my screen? Yes, we can. Great. So Senvital is a startup in e-health, and we are creating innovative solutions to resolve problems that we encounter in the health sector. 300,000 women experience issues during childbirth. A number of Senegalese women have perinatal issues every day, and this is due to medical errors and a number of other reasons. And this is why we have created the health passport. What is the health passport? This is a solution that uses a QR code. And with this QR code, you can see the profile of patients. You can see what their blood group is, their allergies, their medical history, the emergency contact number, and information about their identity. With the features, we have a vaccination log, we have health documents. You can also book appointments, and there is also remote consultation, and this can all be managed through the interface. We also have a remote consultation service, as I mentioned, and this makes it possible to see a health professional at any time through a video call or a telephone call or on WhatsApp. We answered a call for projects put out by the Health Ministry, and we have a self-test system, a self-test questionnaire. We have statistics, and we're able to transmit documents on pre-COVID-19. The platform is also available on the mobile app on the internet interface. For the size of the market for e-health, the global market is $989 million. And so that's a growth of 12.8%. During the first test phase, we rolled out in 2 companies and schools, and then we ramped up to 100,000 users. We are in B2C, B2B with health professionals, schools, universities, and businesses, and B2G for governmental bodies. What is our business model? Here we have our subscription model. So a monthly subscription is 2,000 francs CFA per month, and for health professionals, it's 60,000. We take a 10% commission. For our objectives for the end of the first quarter of 2021, we hope to roll out internationally, that is to say in Senegal, Guinea, and Mali. We hope to roll out in 10 companies, and we hope to increase our user base to 150,000, and we hope to be present in 30 health structures and to carry out 20,000 remote consultations. We are a group of young people from various backgrounds and fields: health, law, cybersecurity. And together, we think that the most important thing is to save lives. Thank you very much.
Merci beaucoup. Merci
Thank
beaucoup,
you very
Caroline.
much. Thank you very much,
Je vais tout de suite
Caroline.
entrer dans le vif du sujet et
I'm going
t'introduire
to go straight into the crux
dans
of
le
the
débat qu'on a déjà
matter
commencé
and
avec tous
include
les
you
autres
in the
panélistes.
debate that we have
Aujourd'hui, ton
already
modèle
started with
économique,
the other members of
est-ce
the
que
panel.
tu es en partenariat
Your business model,
avec des corporates, avec des
are
grands
you
comptes
working in partnership with
qui
corporate
aujourd'hui,
companies,
par exemple,
major companies,
peuvent voir dans ta solution un
that
moyen de
see the
toucher
added
une
value
population
of your
qu'elle
solution
touche
and a way
plus
to
difficilement.
reach
Aujourd'hui, est-ce que tu arrives à
populations that
travailler
are difficult to
avec
reach
les
today?
entreprises, les grandes
Have you worked
entreprises
with large
sénégalaises,
companies, large Senegalese companies,
par exemple sur des budgets de RSE, etc.
on CSR budgets, for example? Yes, hello everyone. I'm one of the co-founders of the Senvitel startup. So in this framework, we worked with Les Sanotel, and this made it possible to really speed things up. We work with companies for CSR. We have a go-to-market strategy. We organize a health visa caravan. It's a series of free consultations in the field of medicine, and this is fully funded by large companies as part of corporate social responsibility. So this enables the population to benefit from free medication, etc. This enables us to create medical files for the population. And so at the moment, we are in partnership with two structures, not just for the occupational health aspect of the solution, but also for creating other digital solutions for health.
La même question
Thank you very much. I'm going to ask the same
Mahmoud.
question to Mahmoud.
Est-ce qu'aujourd'hui, Smartbox est approché par des
Has
corporates, des
Smartbox
grands
been
comptes
approached by
qui s'intéressent justement
large companies who
peut-être
are
des
interested
opérateurs
in
portuaires, des transporteurs
the
logistiques qui sont intéressés par votre
logistical
solution pour développer
transporters,
des
perhaps who are
partenariats?
perhaps interested in your solutions and interested in creating partnerships with you?
Well, we were contacted by CMA CGM. So it's the world leader in shipping. And they offered, well, they mentioned a possible partnership for logistics and shipping and road transportation. We are currently negotiating because this is really important to us. Our product can be transported via road transportation and shipping. So it would be nice for us to have a partnership with such a company.
Merci beaucoup. Merci Mahmoud. Je vais poser la même question
I want to ask the same question
et Malik, si tu peux remettre ta caméra.
Malik, can you turn your
je vais
camera
même vous
on,
inviter à mettre
please?
tous votre caméra
And I
parce
would
que
like to
maintenant que nous avons
invite you
pu
all
avoir
to
Caroline,
turn
vous
on
êtes
your
au
cameras.
complet et on va
You
pouvoir
are all
débattre
here
ensemble sur
right now because
15
Caroline
minutes
is with us as
qui
well.
viennent.
So please
Malik,
keep your cameras on for the
est-ce que
last
tu es
15
accompagné
minutes.
par des corporates?
Malik,
Quel
so
rôle
are
jouent les
you working
corporates dans
with any
l'écosystème? On parle
companies
souvent
right
des
now?
startups, on
What
parle
is the
souvent
role of
du
bigger
gouvernement,
companies
mais
in
est-ce que
your
les
ecosystem?
grandes
We
entreprises
mentioned the role of
doivent aussi
governments
prendre leur part
and
et travailler
public
avec vous
authorities. Do you
pour
think
développer
companies
ensemble
should
des
work with you as
alliances
well to develop together
et
new
des solidarités
partnerships and
digitales, notamment pour résoudre ces grands
maybe
problèmes
to create some
de son
kind of
public?
digital solidarity? What do you think? Well, all these issues that we are facing, well, no one can solve them on their own, really. And personally, I like to use the word ecosystem. Biologists know about ecosystems, right? It's a group of different entities that interact with each other. So currently, we see that entrepreneurs, the civil society, are taking initiatives to find solutions to problems we are all facing. So I think the state has a role to play. I think it should support the activities. And yes, I do believe companies have a role to play too. We are working with about 30 phone operators on the continent, They are our primary partners, and I would like to thank them because they are helping us, because we are able to use their infrastructures. I think on our own, we wouldn't have been able to do it. Because we were supported by these operators, we managed to do what we did. So I think at the end of the day, we are all facing the same issues. We are all facing the same challenges. And we need to take up these common challenges we are facing in the years to come. I'm sorry, I'm really repeating myself here, but what I'm trying to say is that despite our individual talent, despite our individual endeavors, it will be hard to solve any health challenges or climate challenges on our own. So I really hope that this COVID-19 crisis was an opportunity for us all and for bigger companies to really realize this fact and to take it into account and to understand that all the partners that are here today, for example, and others need to see each other, they need to speak to each other and work together, and need to share financial means, infrastructures, communication means. We need to really use everyone's assets to really solve all the problems we are currently facing. I think the only way to do it is together.
Merci beaucoup, Malik.
Thank you very much, Malik.
Me tourner, I will go back to you, Luther. Prosperity is quite an inspiring example and quite successful. I think you managed to raise money recently, right?
Sorry, come again?
I believe that you raised money.
Yeah.
You succeeded raising money with
yes.
Recently, right? Yes.
Yes. So we raised our
pre-seed. To do that. Yeah. How did you manage to do that in the middle of one of the worst crises? How did you manage to convince investors? And is it a message of hope for all African startups that it's not because this pandemic that we cannot succeed and we cannot convince investors to trust in our?
Yeah. So I think one of the things that contributed to us being able to raise money at that period was the fact that we were able to grow at that period, right? Because at that time, there was a lot of, activity especially in the food space. So that prompted, investors to look in our way. And because we were gradually growing, they saw the future in us, in enabling, betting on us with their money. But overall, like everybody has said, the pandemic has had its good and bad parts, but I think it had also put us in the light in a sense, because everybody, when the pandemic started, everybody was really concerned about Africa because Africa had poor health system. We had everything, not going well for us, but somehow, some way, we were able to survive that, the height of that pandemic. And I think that's a positive. That shows that it speaks to the resilience of Africans. It speaks to the ingenuity of our innovation and all of that. And I think that shifted people's opinion about what they expected of Africa. And I think in the future this will continue to help us as we live, as we get out of this situation and build for the better. So that's the way I see it.
Thank you very much, Luther. Thank you very much. Je vais poser la question à Cédric. Aujourd'hui, Cédric, tu as réussi à rassembler plusieurs milliers de praticiens sur ta plateforme. Tu es aujourd'hui à la recherche de relais de croissance pour accueillir encore plus de solutions et agréger encore plus de solutions. Est-ce que tu recherches aujourd'hui des investisseurs? Et quelle est ta stratégie? Quel type d'investisseurs tu recherches actuellement?
Investment are you interested in currently. Thank you, Samir. Well, you know, like all startups in the world, we are looking for investors. Even though the investment market in French-speaking African countries is not the same as in English-speaking African countries. So we try to attend different forums, conferences, hackathon, where people meet, where companies get together, and where we can network, really. So that's what we're trying to do. Historically, we have been involved in a few challenges that we won, international forums with startups and investors, and we managed to collaborate with incubators, international ones in Morocco, for example. There's one called Impact Lab Africa. It's a great Moroccan incubator, and we worked with them for a year in collaboration with GSM Inouï. And we got some support, financial support from them. We also worked with European investors and American investors. And it's Green Day Capital that has been our main partner. It's an investment fund, a Pan-African investment fund. And yeah, it was one of our main partners.
Oui, je pense aussi que Presse Peli est également accompagné par Green Tech Capital. Donc on voit bien que de plus en plus d'investisseurs aujourd'hui croient aux startups africaines et s'engagent pour soutenir les startups africaines. Je vais revenir vers vous, Caroline. Quels sont aujourd'hui vos besoins en financement?
Can you tell us a bit more about what you need right now in terms of investment? Well, currently, we need about 40,000 euros, and we have raised half of the financing we need. Orange Fab is supporting us, and Orange Corner. So we need about 40,000 euros for our production unit and for our team.
Et juste pour préciser, l'ADER, c'est le ministère de l'entrepreneuriat du Sénégal.
It's the Ministry for Entrepreneurship in Senegal. Yes, that's what it is. So this department is already supporting us, and we got a grant from OSIF. It's the fund of Orange Corner. And we are also supported by the same fund, another one from Orange Fab, one from the African Bank for Development. So Senvital is considered as one of the top 20 solutions to fight the pandemic, and we are still waiting for 50,000 euros to finance the gap that we currently have, like my colleague said, for our production unit. Samir, I don't know if I can say a few words. Is that okay? Yes, please do. Yes, we are speaking about ecosystems, and today in Senegal, I think there is a better ownership and understanding of the role of SMEs and startups. And there is an initiative currently supporting smaller companies, and it didn't happen, it wasn't the case before. There are many funds in Africa that are able to grant money for up to $1 or $2 million. And right now, there are more investors that will support smaller companies. And that's why I wanted to speak, because I was also supported by the same fund that has supported Senvital. And I think it's important to say that there are funds, there are opportunities for people who want to start their business. There are people who are willing to take a chance and willing to support our projects. So I wanted to say this, and insist on this.
Beaucoup Malik, effectivement, c'est aussi important de dire que l'État, quand l'écosystème devient mature et que l'État joue son rôle, l'État fait partie, en tout cas les dispositifs font partie de cette chaîne de valeur et de l'écosystème indispensable pour permettre aux startups, aux entrepreneurs de trouver les fameux relais de financement, le fameux petit ticket, le premier ticket parfois d'amorçage pour traverser cette vallée de la mort. Et si on n'a pas ce premier ticket, souvent c'est la fin de l'aventure. Et avant de viser de lever 2, 3, 4 millions, parfois il faut simplement arriver à lever les 50 premiers milliers d'euros, puis les 300 000 euros, puis les 1 million d'euros. Mais voilà, c'est vraiment important de souligner ça. Et on salue d'ailleurs l'ADER qui, au Sénégal, finance beaucoup de startups. Et c'est vraiment important de le dire. On arrive quasiment à la fin. Je vais vous poser à tous une dernière question. Je l'ai déjà un peu posée à toi, Malik, donc je vais la poser plutôt à Adama. Adama, quels sont tes projets pour l'année à venir et quels sont les prochaines steps pour Diagnose Me?
What are the next steps for Diagnose Me? Diagnose Me was not only conceived for COVID-19. We do believe that Diagnose Me will be useful for other pandemics. We have gathered some support to carry out our project, and we want to be able to deal with any kind of a pandemic that could come up with our app. So we will develop Diagnose Me. And we want to take into account
Merci beaucoup. Je vais poser la même question à Caroline. Quels sont vos projets pour l'année à venir et les next steps pour votre startup?
What are the next steps for your startup? Well, about the next steps, next week, we want to set up our remote consultation mechanism, and we will deploy our solution, the health passport, with activities particularly directed at this remote consultation option. And we also want to promote our health symptoms monitoring system.
Merci beaucoup. I will ask
thank you.
The same question
I'm asking Luther the same question.
Mahmoud, si tu es toujours là.
Oh, sorry,
mais
Mahmoud,
avant
rather.
que tu poses la question, parce que j'ai peur que Luther s'en aille et Moson Mola.
Luther,
I will ask you,
sorry.
Luther and Moson Mola, what are the next steps for you for Price Paddy for 2021 and 2022?
So on the part of the company growth, we are looking to go into other states in Nigeria. Then from there we will be moving to other countries. Mosu, maybe you want to hint on the farmer project we are working on to finance farmers.
Okay, so we started sending word to farmers that are around us. And we have a long list of farmers with different kind of products. And then, so the idea is that we intend to begin to ask these farmers to farm for our customers directly. So farmers are farming directly for our customers, and then we're able to influence the quality of food, and influence lots of things about the food that we serve to our customers.
Yeah, so before now, we've been, getting these items from farmers everywhere. So we want to also run a model where the farmers farm directly for us. So everything they do is directly for the cooperative. So we think that's like a model we can move into the future. So that's part of our plans for the future. Thank you very much.
Thank you very much to both of you. Thanks. Je vais poser la même question à toi, Cédric. Tes prochaines steps
Cédric, the same question for you.
What
are the next steps for the upcoming year? Thank you very much, Samir. And thank you for all that you do. for us, for Rema, we have the same vision, and that is to improve the quality of medical decisions taken. We also want to work on the elements that cause these errors. And this is due to the low level of information among doctors, the isolation of doctors. And so there is the first lever, and that is medical collaboration. We've been working on that for 4 years, and now we have an effective solution that can increase collaboration between healthcare professionals. So we've sorted that first level out. The second thing is to improve the level of information available. Resolving medical error requires scientific proof, and the scientific proof accessible in Africa is not accessible to the health sector because less than 10% of the research conducted in Africa is available online. And so what we're doing, using a tool dedicated to African research, we are going to make all of this research accessible on our platform to healthcare professionals. They will be able to access that information and consult that information in real time, and this will improve their performance and improve the quality of the decisions they make. And that's really the challenge that we have this year. And today, today, we rolled out a new version of Rema that integrates the aspect that I just mentioned to you. The third thing for the future is medical training. We are used as healthcare professionals, we're used to not necessarily being informed in what's going on in science, but things change, therapies change, treatments change, the way of applying those treatments change. And therefore, we want to ensure continuous professional development for health professionals so that they can receive training from hospital universities, so that they can improve their medical practice. So those are the three things that we want to work on. And we want to ensure that we integrate the social and commercial aspects along the entire process.
Je vais maintenant demander
Thank you very much, Cédric.
Mahmoud s'il est
I'm
toujours
now
avec
going to
nous.
ask
Je pense qu'il est
Mahmoud if
parti,
he's
malheureusement.
still with us.
Alors,
I think
peut-être
that he
Malik, le
may
mot de la fin.
have left.
Et je fais
So
faire ensuite une petite
Malik then
conclusion avant de
was
remercier
the final
nos
word,
hôtes.
and I'm going
Malik.
to give the floor to Malik. Okay, so I have the concluding words then. Well, for me, it's the lessons that we have learned from the pandemic. Personally speaking, I have 3 takeaways. 3 things that as entrepreneurs and as an ecosystem, we need to continue to address. The first thing, the first lesson is that I really learned how fragile human life is through this pandemic. And I really hope that we will be more humble and kinder to one another. I think that's really the first lesson that I've learned. The second thing is that in the end, innovation has always been perceived as a luxury for just a few. We see that that is not the case. We see that innovation is a necessity. And the entire ecosystem must work with hand in hand with people who innovate on a day-to-day basis. And the last point, and this is something that I mentioned earlier on, the challenges of the future, the healthcare challenges, the climate challenge, the employment challenge. When faced with these challenges, when faced with these difficulties, we always try to blame the other. With COVID, there's no difference between a Senegalese person, a person from Burkina Faso, a person from Benin. There's no difference between white or black. Even if we are often tempted by this division, we need to be mindful and we need to be courageous and we need to stand up and say that we will overcome, but we have no choice but to work together. And I think that those are my final words.
Merci beaucoup, Malik. Merci
Thank
beaucoup.
you. Thank you very much, Malik.
Eh ben, nous arrivons au terme de cette discussion
We are now arriving at the end of our discussion, a very interesting discussion. We did not see the time go by, and I can see that there are lots of congratulatory messages, lots of people who have been following us online. We have lots of messages of well done. Well done for your resilience. Well done for being an example. Well done for your inspiration. And I think that there is a lot that we can learn from you, and there's a lot that we can duplicate as well from these innovations that we can perhaps implement in Europe, not just in Europe, but globally. And I think that there are a lot of paradigms that are being shifted, that are being disrupted, to use Luther's expression. There are other digital opportunities out there, and we need to know how we can take these constraints and harness them and turn them into opportunities. And what we see on the African continent is that we see the emergence of innovative solutions that will be durable and that will affect many sectors: energy, access to energy, education, farming. And of course,
on n'en a pas parlé, on aurait pu en parler avec Malik pendant des heures.
Didn't mention it.
Du mobile money. Comment est-ce que le mobile money, les gens sont en train de se débarrasser du cash.
Everyone is getting rid of cash now.
Toute cette transformation aujourd'hui font que
all of these life transformations
arrivent à transformer le challenge du Covid en opportunité.
The African continent is really taking the COVID challenge and transforming it, turning it into an opportunity. Luther has a request. He wants to know whether we can take a group selfie. And so I'm going to ask as many people as possible, anyone who is on Zoom, to turn their cameras on, please. So everyone, the auditorium, all of us, there are many people. Lisa, everyone, please put your cameras on so that we can take a group selfie. So please turn your cameras on, the auditorium too. I don't know who is there, but I'm going to ask you to put your cameras on so we can take a group photo.
Mahmoud est parti malheureusement, il m'avait déjà prévenu.
It seems that Mahmoud has
left. Oui,
c'est
pas grave, vous pouvez garder le masque, il n'y a pas de souci.
And you can keep your masks on too if you need to.
Maxime, peut-être?
Maxime.
Voilà. Et Cité des sciences et de l'industrie, je ne sais pas qui c'est.
Cité des sciences et de l'industrie, I'm not sure who is there, but in any case, I suggest that we...
Ah oui, voilà. Et Mark Eden aussi,
Mark Eden, we'd like to see you too.
On va faire un petit selfie.
So let's take a quick selfie
Sabine.
with Sabine as well.
Tous
and I'd like to thank all of you
for
your contribution and your enthusiasm today.
Un petit coup comme ça. Vous me voyez? Ouais, ça marche.
I think that worked.
Okay. Alors moi j'ai presque plus de batterie.
It seems I'm running out of battery, so I hope that picture was taken.
Et merci à tous.
Merci à
Universcience. Et c'était un plaisir, un honneur de modérer cette session.
And an honor to moderate this session. Despite the constraints, we got there in the end. And I would like to thank all of you, and thank you to the audience as well. Thank you to Africa 2020. Thank you, Sabine. Thank you, Mark Eden, for your trust. And I would like to say see you soon on the 8th of April for Emerging Valley.
Et je vous dis à tous à très bientôt.
And I will see you all soon. Thank you very much.
Bye. Au revoir.